Hello everyone, my name is Muhammad and today I'm going to share a case with you guys. Let's have a rapid look at it. So there's a person named as Joan arrived at a local hospital with her father-in-law Nigel to seek treatment for him. Nigel was visiting Joan and her husband from his home country while Nigel has been at their home. Joan and her husband have noticed that he's not been feeling well, and after conversations with him he stated that he has not felt for quite some time but did not want to worry them. His condition worsened today, and Joan decided that she would take him to the emergency room. When they were taken to a patient room, Joan asked for an interpreter as Nigel is non-English speaker and Joan has limited fluency in his language. So the physician came into the room to examine Nigel. After the examination, he ordered several blood tests based on Nigel's symptoms and left the room. After the tests were completed, Nigel and Joan were left in the room for several hours. The interpreter was no longer with them, and they did not have the physician or any other hospital staff come to check on them. Joan was afraid to leave the room in the event that the physician would return while she was away. At some point, a nurse returned to the room, began discussing the need to set up an appointment with an oncologist, and provided information on the side effects of chemotherapy, after which she promptly left the room before Joan could ask any questions. Nigel was confused about what she said. As there was no interpreter in the room, John was in shock, realizing that her father-in-law had cancer and that she was now tasked with telling him using her limited vocabulary in his language. She proceeded to tell him that he had cancer. Now let's have a look at some basic errors that were occurred during the follow-up of the case. So, first of all, lack of continuous interpreter services or inadequate language support. There was no detailed explanation. Upon arrival at the hospital, Joan rightfully requested an interpreter to assist in communicating with her father-in-law, who is a non-English speaker. But interpreter facilitated communication during Nigel's examination by the physician. However, after the initial assessment or examination and tests were conducted, the interpreter was no longer present. The lapse in continuous interpretation support meant that Nigel and John were left without ability to communicate effectively with the healthcare team. When the nurse returned with the critical information about Nigel's condition, there was no interpreter present, leaving Nigel unable to understand the medical information being conveyed. Joan, with a limited proficiency in Nigel's language, was forced to relay the diagnosis and treatment plan, a task for which she was unprepared and which placed undue stress on her. Okay. So the information delivery or timely updates. Look at it. Effective communication is a cornerstone of quality healthcare. In this case, Nigel's initial examination and the completion of his blood test, the healthcare providers did not communicate effectively with Nigel and Joan. They were left in the patient room for several hours without any updates or information. When a nurse eventually came back, she quickly discussed setting up an appointment with an oncologist and provided information on the side effects of chemotherapy, then left before Joan could ask any questions or seek clarification. This abrupt and incomplete communication approaches left Nigel confused and Joan in shock. They were not given the opportunity to understand the severity of Nigel's condition, the version behind proposed treatments, or the implications of a cancer diagnosis. This poor communication likely left both feeling abandoned, anxious, and distrustful of the healthcare system. Such experiences can lead to poor patient satisfaction, decreased adherence to treatment plans, and potentially poor health outcomes. Then, of course, lack of empathy. It was evident through inadequate communication and information sharing, absence of continuous interpreter services, rush delivery of bad news, and neglection of emotional support needs. After the initial examination and test, Nigel and John were left alone, as we know. The interpreter's intermittent availability left Nigel struggling to understand critical medical information. The nurse rushed communication of Nigel's cancer diagnosis without allowing time for questions, showed insensitivity to the emotional impact of such news. Throughout the experience, there was no effort to provide emotional support or counseling, leaving Joan to cope with the shock alone and Nigel confused, and anxious. Empathy involves understanding and addressing the emotion and informational needs of patients and their families with compassion, which was clearly lacking in this case. And at last, poor coordination. We can see that there is an obvious lack of coordination among the different medical professionals providing Nigel's care. The rapid shift from the doctor's evaluation to the nurse's informational presentation led to a lack of clarity in the care provided. The disarray may result in a misunderstandings, communication problems, and breaks in the continuity of the care. So, what should have been done to avoid these kind of errors? First of all, regular updates. In a patient centered care model, providers should provide regular updates and check ins, ensuring that Nigel and John were informed about the progress of tests, the expected timeline for results, and the next steps in care. Regular communication and the presence of healthcare staff would have reduced the sense of abandonment and anxiety that Nigel and John experienced. It would have kept them informed and reassured, enhancing their overall experience and ensuring they felt valued and cared for. This continuous engagement is crucial in maintaining patient and family trust and satisfaction. After that, of course, continuous interpreter services. From the moment, a patient centered care approach would have ensured that an interpreter was present at all critical points of the care. This includes during the initial examination, while explaining the test results, and particularly when discussing a diagnosis and treatment plan. Continuous interpreter support would have ensured that Nigel understood his medical condition, the implications of his diagnosis, and his treatment options. This would have empowered him to make informed decisions about his care. Joan would have been relieved of the burden of translating complex medical information, allowing her to focus on supporting her father in law emotionally. The most important one, lack of empathy. So, what the nurses or the physician should have done to improve the sensitive, patient centered approach would involve delivering the news in a compassionate manner, ensuring an interpreter is present and providing ample time for the patient and family to process the information and ask questions. The approach would have allowed Nigel and John to fully understand the diagnosis and its implications. They would have had the opportunity to ask questions, express their emotions, and receive immediate support from the healthcare team. Such sensitivity and support are essential in helping patients and their families cope with difficult news and make informed decisions about this. And at last, I would like to talk about patient focused strategy. Implementing a comprehensive patient focused strategy that includes language support, structured communication, protocols, coordinated care teams, education and support, resources, empathy training, and technology integration would significantly improve the care experience for patients like Nigel and their families. These strategies ensure that patients and the families are well informed, supported, and actively involved in the care process, leading to better health outcomes and higher patient satisfaction. So, I think the basic errors in communication, interpreter availability, delivery of critical information, emotional support, and coordination significantly impacted Nigel and Joan's experience, exacerbating their already stressful situation. Addressing these issues through a patient centered approach would involve ensuring continuous interpreter services to facilitate clear communication, providing regular updates on their medical status and treatment plan, delivering bad news with empathy and understandings, offering ongoing emotion support to help them cope with the psychological aspects of their illness, and improving coordination among healthcare providers to ensure seamless care transitions. By implementing these measures, healthcare providers can enhance Nigel and Joan's overall patient experience, empowering them to actively participate in their care journey, ultimately leading to better health outcomes and higher levels of satisfaction. And thanks a lot.